When you hear the terms ADD and ADHD, it's sort of broad, isn't it?
It is.
I mean, it's a big umbrella. So can you break it down for us?
Yes. So really, when we're talking about ADD or ADHD inattentive type, what we're talking about are those children who really are struggling in school. And that's oftentimes what we see, because in order to even receive the diagnosis, it has to occur in more than one setting. So your child that's a little bit hyper around the holiday parties is probably not your child that's going to have ADHD. But when we start seeing is when it occurs at home and school, or in a variety of settings where the child cannot sit still, they're making really careless mistakes on their work, they're just trying to get through it just to get through it. And some parents will say, well, my child might focus on video games for 5 hours. But when it's something that's more cognitively challenging, like schoolwork, like learning, they will just try to avoid those tasks altogether. And we see that they're just restless all the time.
How do you go about diagnosing a child with either ADD or ADHD? And I guess my follow-up question to that is going to be like, are we just labeling too much? Because, I mean, a child can be jittery, but it doesn't mean that they have this, right?
Yes. And oftentimes ADHD does get diagnosed in children where there may be another disorder occurring or something else occurring. Oftentimes in early childhood, symptoms of even depression and anxiety can look like symptoms of ADHD because they're children. And oftentimes people will go to their pediatricians or they'll go to their neurologist or to a psychologist to get them further evaluated. And the evaluation process is actually quite strict in a way. We look at their cognitive, we look at their working memory, we look at their executive functioning, their planning, their organization through a variety of measures. We look at how long can they sustain attention. And it's done in a one-to-one setting when we assess as psychologists. So the way we also interpret it is how they perform in comparison to other children their age. And not only that, this is on a one-to-one setting. If they were in a classroom setting where there's 25, 30 children and they're not able to attend on a one-to-one, then we can really see, is this ADHD?